A 25 years old junior doctor has a chest X-ray performed as part of the routine insurance medical examination. The X-ray shows evidence of rib notching. Auscultation of his chest revealed a systolic murmur, which is loudest at the posterior aspect of the fourth intercostal space. What is the most likely diagnosis? Here the options. Options are patent ductus arteriosus, aortic coarctation, aortic dissection, cervical rib, and subclavian steel syndrome. So let's see the coarctation of the aorta. Aortic stenosis. Actually, coarctation, that means the stenosis of the aorta, and it is at the site of the ductus arteriosus insertion point, and it is more prevalent in the boys than that of the females with Turner syndrome. And patient present with symptoms of arterial insufficiency such as syncope and claudication. So the coarctation of the aorta, it is the stenosis of the aorta, usually distal to the attachment of the ductus arteriosus, and it is more common in boy than that of the female with Turner syndrome. Patient may present with symptoms of arterial insufficiency, including the syncope and claudication. Here we can see this is the aorta, and this aorta is arising from the left atrium and it goes downwards, but at this point here we can see this is the stenosis point. Here the aorta, this point, it is the stenosis point, and for the coarctation here we can see there as the stenosis at the point, so the blood usually cannot go to the distal part. Very small blood goes or blood cannot goes. The coarctation of the aorta, blood pressure mismatch may be seen in case of mismatched pulse pressure in the upper and lower limb. So in case of the coarctation of the aorta, here we can see this is the descending thoracic aorta. So blood cannot goes to descending thoracic aorta, but it can goes to the right side and left side of the upper limb. So upper limb pulse pressure normal, but in the lower limb there is reduced pulse pressure. And what are the treatment option? Treatment option is the angioplasty and surgical correction. So angioplasty or surgical correction is the treatment option, and the clinical feature is differs. It says radiofemoral delay. And the coarctation of the aorta may occur due to the remnant of the ductus arteriosus acting as a fibrous constricting band of the aorta, and weak arm pulse may be seen. Radiofemoral delay is a classical physical sign finding, so we should search for radiofemoral delay in case of the coarctation of the aorta, or when there is radiofemoral delay we should suspect for coarctation of the aorta. Collateral flow through the intercostal vessels may produce notching of the ribs. That means in the lower limb there need blood, so in the another side, that means from the intercostal artery the blood goes to the lower limb bypassing, and for this condition the artery of the intercostal vessel, artery of the intercostal area, they are enlarged and they produce notching in the ribs. And when disease in the long standing, actually this case notching develop. So what is the answer? Answer is the aortic coarctation, because the X-ray show evidence of the rib notching. Other clinical feature including the radiofemoral delay.